Many times parents come to my clinic with babies who are less than 6 months and complain that doctor, my child is crying for last several hours and no matter what we do, baby does not stop crying and they are very anxious and stressed about it. So these crying episodes are generally called baby colic or infantile colic. And today I am going to talk about what is baby colic, what are the common signs and symptoms of baby colic, what are the reasons behind these crying episodes, what we can do to prevent these episodes or reduce the number of these episodes, and what actually can be done by parents to relieve the crying or stop the crying during the episodes of crying. So baby colic is basically episodes of excessive crying which starts in children from the age of 3 to 4 weeks and continues till the age of 4 to 6 months and generally stops after the 6 month of age when baby learns to sit. And these episodes generally happen in the late evening or in the night. A baby who was previously feeding well, active and playful suddenly starts to cry very loudly in a very high pitched noise and it seems like screaming. Baby's face turns red, baby tries to frown or the face is having expressions of grimacing. The body becomes stiff and they twist their body in different ways and the hands and feet become stiff and the baby clenches its hand. So these things all put together is called infantile colic, and this is a very common phenomenon, happens in 20 to 40% of children between the age of 1 month to 6 months. We generally diagnose baby colic by a rule of 3, so in which we say that baby cries more than 3 hours per day for more than 3 days in a week and it happens for 3 consecutive weeks. So this is basically used to diagnose baby colic, but I always recommend once at least you should visit your pediatrician to rule out other causes of excessive crying in children before understanding that it is baby colic, because baby colic is something which is not a serious illness, though it may seem to be very annoying and difficult to handle, but it is not a serious illness and it does not cause any serious harm to the child. Now coming to the causes of baby colic, it is believed that baby colic happens because of excessive gas accumulation in the stomach or intestine, or whatever the gas which is produced by digestion of the milk, it is not able to come out. So this gas accumulation, what it does is, it stretches the baby's intestine and baby's nervous system or the intestine is immature. So because of this stretch, they feel too much pain and they become irritated because of this and start crying. This is the main reason why the baby started to have infantile colic. And apart from this, there are many contributing factors like overfeeding, underfeeding, excessive swallowing of the air while feeding the baby. Actually what happens is baby swallows a lot of air during the feeding and it accumulates in the stomach. If it is not able to come out, the baby feels a lot of pain. So these are the things which can lead to baby colic. Sometimes baby's intestine is allergic to some of the food items which is taken by mother, like cow milk protein or caffeine. So these things sometimes trigger a lot of reaction in the intestine of the baby and they start crying. So many times it has been seen and it is proven by research also that avoiding certain things in mother's diet who are breastfeeding can help the baby in this situation to reduce the number of infantile colic. Now coming to what we can do to prevent colic episodes. So like I said, adequate burping about 15 to 20 minutes after each feed actually relieves this gas which is accumulated during the feeding. So that gas comes out. The burping is one of the most effective way to reduce the number of episodes of colic. So you can actually avoid overfeeding, underfeeding, don't keep the baby hungry for a long time, keep frequently feeding the baby and do gentle burping after every time 15 minutes. Ensure that the baby is latching properly on the breast. This picture will help you in understanding what is proper latching. Now coming to what you can do when the baby is having excessive crying episode or the colic episode. So during the colic episode, few things which help is gentle movement of the baby. So you can actually take the baby in your lap and do back and forth rocking or gentle tapping or massaging on the back. Something called colic massage also helps. Colic massage is just you have to rub the baby's tummy gently in a clockwise manner. With some oil also you can do, or you can gently do with your hands itself. It may help. Sometimes movement like bicycling of the limbs onto the tummy, it also helps. Apart from this, swaddling the baby in gentle clothing helps. sometimes singing to the baby, playing white noise or light soothing music helps the baby to get diverted and stops the baby from crying. Apart from these, you can try pacifier. Sometimes pacifier helps because baby have a very strong urge to suck. So sometimes pacifier actually helps the baby to stop crying. One of the most effective tools which I have used in many of my patients is I tell the parents to take the baby on the terrace or in an open space like balcony or the corridor and gently sing to baby and tap the baby on the back and make the baby feel comfortable. So once the baby goes in the open space, they stop crying. This is commonly seen. We prescribe sometimes antispasmodic or anti-flatulent medicines like simethicone or fennel seed oil, which in many cases relieve the baby's colicky pain. And one more thing which sometimes helps parents is taking the baby for a car ride on a smooth road. So the vibration of the car or the white noise of the car engine sometimes relieves the baby's pain. See, baby colic are self-resolving illness. It is not a serious illness, and most of the time, by the time your child becomes 6 months old, these things will go by itself. Baby will be able to control its intestines reaction in a better way, and you will be not having this problem again. So I hope this information helps you in handling your baby while excessive crying. If you like this video, please subscribe to the channel and share with other parents. If you have any questions, please ask in the comment section. I will be happy to reply to all the queries. Thank you for listening to us.